Welcome. I'm Stuart Van Horn, the Chancellor of the West Hills Community College District, and it is my absolute pleasure to welcome you to the 7th Essential Elements series of West Hills Community College District. I have greatly appreciated the pleasure that I'll have with you in the next couple of minutes to welcome you to this policy series. And for those that have joined us in the past, Essential Elements is, at its core, a convergence of us to broker solutions to challenges facing the Valley. We have brought together a convergence of business and industry, education, policymakers, and stakeholders who share a passion for the Valley. And this session, as it has been from the beginning, is always designed to stimulate actions and alliances. And for those that have been here before, you understand that the format is structured to build upon what we learn throughout the day, and then we hold ourselves accountable for action tomorrow. You may know that our series launched in 2014 with The Very Last Drop, Managing Water and Food Production. And as you know, water and food are arguably the most indispensable pillars of the state's economy. There needed to be integrated, linked actions and alliances with greater coordination and accelerated implementation. This series stimulated those alliances. Copies of all of our action reports are displayed in the registration table, and they're available on the Essential Elements series website. In June of that year, we turned our attention to energizing the Valley with a focus on economic development, job creation, and workforce requirements for fossil fuels and renewable energy industries. In November, we hosted Trading Partners, Export Evolution, Logistics, and Valley Economic Development, and we followed that with our Shifting Ground series in November 2015, and in 2016, Powering Sustainable Economic Development for the San Joaquin Valley. Last November, we gathered top leaders from the state and region to come together and broker solutions to the lack of broadband internet access coverage for the residents on the west side of Fresno County. Our work today continues with that broadband initiative. The statutes and regulations that result in disinvestment in our rural economies is unacceptable on the west side, especially now as West Hills transforms teaching and learning in a digital era. Numerous alliances and actions continue to be forged because of all of these Essential Elements gatherings. We are delighted to have played a role in brokering those alliances and actions. We've done our best throughout the years to engage various forms of communication, including a dedicated website that serves as your one-stop portal for all conference materials, PowerPoints, program content, actionable outcome reports, and even numerous web-related articles and industry reports. As like many of you in your industries, we use Facebook, Instagram, and Twitter to spread the word, and I invite you to follow us at WHC Coalinga or WHC Lemoore or WHCCD Workforce. We've got them all covered. You know, planning this event is a shared experience, and we're grateful for your attendance, and we're especially grateful to the Gualco Group and the California Endowment, today's premier series partners. I also want to acknowledge many staff and faculty from our colleges in the room, most notably those behind the scenes, those that welcomed you when you came to the registration table, Kathy Finster, Michelle Kozlowski, Karina Perea. You have some people behind the scenes making me look good on the tech side with Carlos Posadas and Jeff Seed from our IT and marketing departments. You have Amber Myrick, our marketing director. You have some very distinguished administrators and faculty from each of our colleges, and I want to personally thank them for their participation today, because the faculty and those administrators are the ones that will be in the trenches. They'll be doing the heavy lifting with the outcomes that we produce today. But we're also proud to include a wide range of partners and sponsors of this series, And many of them have been with us since the original Essential Elements series, and we've added a few more along the way. Their contributions and continuing efforts of our foundation, our Alex Perez, our foundation director, is here. Our colleges in our district continue to underwrite the cost of this no-fee series. Essential Elements series partners include the California Endowment, Chevron, the wonderful company, Harris Wolff, Central Motherlode Region Consortium, Jobs in the Economy, Doing What Matters, Central Valley Power Connect, and Recurrent Energy. You know, I am so thankful for their participation and support of this concept. So let's give them a round of applause, all of our partners. I'm also pleased to recognize a couple of other folks in the audience today that have made this happen. First off, say hello to the finest Deputy Chancellor in the entire California Community College system, Mr. Ken Stoppenbrink. Thank you. Also, the one that's making all of this happen in terms of logistics, event management, corralling speakers, keeping them all on the same page. Linda Thomas, our Vice Chancellor. Appreciate it, Linda. And as always, a special welcome to two of our dearest and longest time friends, Mayor of Coalinga, Nathan Vosberg. Thank you for joining us again today. And also an extraordinary gentleman named Joe Neves, Kings County Supervisor, who has been with us every single series. Joe, thank you for your continued support. The continuing stewardship of our board has positioned West Hills very strategically in our relentless pursuit of student success. Our governing board has tremendous experience, very stable, and drives our focus on innovations that help our students finish strong in their educational journey. And I invite you to take a closer look at a select number of our board-driven initiatives we are highlighting in our poster gallery out in the foyer. The gallery provides highlights of some of the activities that we have undertaken in recent years. So when you're able, during the break or networking, take a moment and visit those poster sessions in the gallery. I think you'll be impressed with the agility, the innovation, and how nimble West Hills Community College District is in brokering solutions to unique challenges on the West Side. But perhaps more important than anything else with this conference is that this is not your typical academic gab-and-go conference. And I have said this in the past. At each of these gatherings over the years, we've created a successful history of concluding the day as the beginning to a year-long collaboration to improve ag, renewable energy, water management, and broadband internet coverage for the West Side. Today, we will do it again as we envision and re-envision the future of healthcare careers in California. Essential Elements 7 is a foundational event for us in the entire valley. Healthcare delivery is a long-standing concern for every single one of you in this room as future or current patients. Public health issues are a perennial problem. We've experienced a recent hospital closure in Coalinga. That's created substantial hardship in that community. Healthcare jobs of the future are key to patient care and obviously to our regional economy as well. And the front line for Valley healthcare delivery is career and technical education jobs. The main purpose today, the avowed goal of radical surgery today, is to understand the near-term healthcare jobs and design cutting-edge career and technical education to fill those jobs in the 21st century and to improve patient care. Our innovations today are not only for us and our deserving, hardworking students, some of whom will add their thoughts later today. We will ensure that career and technical ed advancements ripple throughout the San Joaquin Valley as we continue to work closely with our sister colleges throughout the region, our primary California State University feeder systems, as well as other organizations like the University of California and regional entities like the San Joaquin Valley Partnership. And our work today is vital, and we hope to end a societal irony that is long-standing. Most of you know our valley is the fruit, nut, and produce basket for the U.S. and many countries. Yet, we have endemic and epidemic public health issues to resolve. Career and technical education-based healthcare professionals are the strong and essential element in resolving healthcare delivery and improving the lives of our citizens in the Valley. Consider the bare facts. The Employment Development Department in 2019 projects in California the need for 13,000 new RNs, 5,000 new nursing aides, 6,700 medical and dental assistants, and over 17,000 medical support jobs like records technicians. So my challenge I'm issuing to you today, and I will be back with you later today in our final action closing session. Please try to stay for that, because I'm going to hold you accountable. And it's really today to get to a point where we roll up our sleeves and get to work. We're honored to have you join us to hear the California Endowment roll out workforce design recommendations, to hear from the Office of Statewide Hospital Planning and Development outline its new initiatives for health professions and facilities, to hear Cerner provide the latest healthcare management trends, and more. Our challenge then is to actively listen, ask probing questions, and craft specific actions to perform successful radical surgery on healthcare careers and technical education, and ultimately on the quality of our lives. So again, thank you so much for spending the day with us. I do hope you find great value in connecting with each other. And today, we have made Coalinga drive to, not drive by. So give yourself a hand for that. So you guys ready to rock and roll? All right, let's get started. I have the honor of introducing Sonia Logman. Sonia has served as Deputy Secretary of Business and Consumer Relations at the California Business, Consumer Services, and Housing Agency since 2015. Sonia works closely with those departments that license more than 250 types of professionals, healthcare, the alcohol beverage industry, horse racing, wagering facilities, and the evolving California cannabis industry. Prior to her appointment, Sonia served as Director of External Affairs at the California Exposition and State Fair from 2013 to 2015, and as Deputy Appointment Secretary in the Office of Governor Jerry Brown from 2011 to 2013. She served in multiple positions in the Office of Lieutenant Governor from 2006 to 2010, including Capital Director, Fiscal Analyst, and Administrative Assistant, and she currently serves as a member of the Board of Directors for the Asian Pacific Youth Leadership Project, which is a nonprofit organization dedicated to inspiring youth to be civically engaged. And boy, is that needed in today's climate. So please, a West Hills Nation welcome for Sonia Logman, our keynote speaker this morning.
Well, thank you so much for that kind introduction, Chancellor Van Horn. As mentioned, my name is Sonia Logman, and I've had the honor of serving our good Governor Brown since the beginning of his administration. So as you can imagine, this week is a bit of bittersweet as we look to welcome our next governor to take the reins. Since the beginning of his term, as the Chancellor mentioned, I've had the opportunity to serve on his appointments team, which was a crash course in how all politics are local and curiously connected to our 74 fairs throughout the state. So I've had my chance to learn about the Central Valley first through that lens and as a member of Team Brown. Moving along at the California State Fair, got to understand the contributions and how important agriculture is to our economy. Again, another tie to the Central Valley. And currently serving at the cabinet level agency that he mentioned, we oversee 11 different state departments, over 5,600 employees, and just more than $2.3 billion in expenditures, mostly derived from licensing fees, as well as federal pass-through dollars. So of those 11 departments, I get to work on these. And I have the distinct pleasure, obviously, to be here today to tell you a little bit more about our work specific to the Department of Consumer Affairs. We there have the opportunity to talk about, to govern professional licensure. When I heard about the series and the fact that you all are taking the time to invest in two important pieces of California's future, of course, our healthcare workforce and the Central Valley, I could think of no other place to be. And I thank you, Chancellor, for making me feel quite at home. I also want to thank, of course, Bob Gore for the wonderful connection. He is a great advocate you all have in Sacramento, making sure that the Central Valley stays top of mind year-round. And, of course, with the Horse Racing Board, I'm pretty excited to be here and in this lovely, lovely hotel. And I feel like every corner there's a little horse racing surprise. So, there's no secret that the healthcare landscape is changing rapidly. Generally, people are living longer lives, but not necessarily healthier ones. The World Health Organization issued a report in 2015 indicating that the number of people over the age of 60 is expected to double by 2050. And again, these might not necessarily be healthier lives. They go on to say that particularly individuals from disadvantaged backgrounds, those with fewer opportunities and fewer resources to call on in that older age, are generally the poorest and the ones with the greatest need. Now add to this the likely challenge that we'll be facing a significant shortage in skilled healthcare workers, from nurses to physician's assistants to those laboratory technicians. By 2025, it's estimated that the United States will need to hire more than 2.3 million new healthcare workers to take on the care of our aging population. But, of course, it's unclear today if we will have enough of those workers to fill those roles. So to focus a bit more on California, here are some of the licensing stats that we have on a handful of healthcare jobs. As you can see, they've generally been yo-yoing around in the same amount and with modest increases lately. Supply and demand is no different here in California than it is in the rest of our country. The need for frontline healthcare workers is certainly increasing. To provide a specific example on other disparities between, a license that requires a bit more robust education and perhaps a more entry-level license, California's supply of pharmacists grew 17% in a 3-year period from 2012 to 2015. However, their support staff lagged behind at only 8% in the same period in terms of the licensure of pharmacy technicians. By 2030, the demand for primary care clinicians in California will increase by 12 to 17% above current demand. But physician supply is expected to decline. We've got quite a few that are ready to retire and enjoy, of course, I'm sure, the many parts of our world. As a result, some experts believe that by 2030, nurse and physician's assistants will comprise of nearly half of our full-time equivalent primary care clinicians. So as we look at this snapshot, we expect the folks on the right there, our MDs are in the lead there, doctors of osteopathic medical, nurse practitioners, and then physician's assistants there on the far right. So why does my agency care about all of this? We, again, fortunately have the opportunity to work closely with the Department of Consumer Affairs. They ensure competent, appropriately trained, licensed healthcare professionals, of course, to meet the diverse needs of California. To accomplish this, Dean Garfilo and his team worked diligently to regulate the practice acts governing 20 different healthcare professions. We also have a few other professions that fall under our sister agency at the Department of Public Health and under the Health and Human Services Agency. But the ones that we have are anything ranging from nurses to acupuncturists, dental assistants to respiratory care technicians, physician's assistants. I think you get the idea. We also regulate a number of the institutions educating our aspiring licensees through the Bureau of Private Post-Secondary Education. And if you could, has anyone visited DCA's website or any of our board information? Great. So dca.ca.gov, you got to jot that down because it's sort of your portal into this window of healthcare licensing. Oh, and sorry about that slide. The Department of Consumer Affairs has 3 core functions. It's really education, licensing, and enforcement. And so when we think about these 3 areas, or sort of our three legs of the stool, Sometimes education, and that's supposed to be licensing there in the middle, are at odds. And so, it quickly brings forward challenges of our different licensing programs. Specifically, the Board of Registered Nursing will have to tackle some of these tough questions into the future. And I understand one of our wonderful board members from the Central Valley, Pilar, will be here later today to perhaps share a little bit of what the Board of Registered Nursing is doing. But I did want to highlight the work of Dr. Morris and his team and what they're up against. There's a tension between the demand between pre-licensure registered nursing education capacity, clinical placements, and acute care capacity. So that means we have more students than places for them to practice their craft, the craft that we actually ask them to practice before their licensure. So between 2007 and 2017, there had been an increase by 6% in the number of nursing programs across the state. That has generated roughly 2,500 enrolled nursing students over that same period of time, with most of that growth happening in one single region, Los Angeles and Orange County, sort of that pocket. In 2017, 77 of the 140 nursing programs in our state, so roughly half, reported being denied clinical space. Luckily, 31 of those 77 were offered alternative sites by industry partners, but the remaining 302 clinical placements were lost, which really heavily impacted roughly 2,000 students. The board has hosted, in face of this challenge, 7 different summits to bring together folks like you, academia, clinical sites, students, policymakers, and others. And I understand they were just down in Fresno recently to discuss the issue and try to find common areas to tackle. And from my perspective, it's been quite interesting to have a driver's seat. I don't come with a healthcare background. I come with a long laundry list of administering state government. And so to have heard the challenges that Dr. Morris is facing, the tensions and questions that he is constantly grappling with and working with his board, do we increase enrollment opportunities at schools, well knowing that clinical placements aren't there, and force that burden onto our students, perhaps creating lapses in the time between education and, to licensure, and sort of what impacts are in between? Should we ask hospitals to bear the cost and additional liability, perhaps, of additional clinical hours if they're offered in their facilities? Do we try to broker an agreement in this space that we don't technically oversee or regulate or have authority of? So what is the role of our licensing bodies? In all of this, there are certainly no easy answers. I just wanted to give that as one example in terms of nursing that I think you all can easily relate to, but bringing it back to the bread and butter, our 3 areas of licensure, I think there are a few observations we can make across the healthcare profession. There's been a steady increase in the California licensing population. It feels like we're always needing more resources at the state to make sure that we're keeping pace with the aspiring licensees. While the healthcare workforce is becoming more diverse, there are certainly still populations that are underrepresented, particularly in the Latino and African American communities as it relates to our practitioners. The healthcare workforce is increasingly made up of our allied health professions, as I mentioned, those advanced practice nurses and physician's assistants. And in terms of geography, there's certainly a shortage of physicians in rural and semi-rural areas, and these gaps are often filled by those allied healthcare professions, which makes it, I think, even more important that rural areas like Kalinga and others have access to these supporting roles in our healthcare workforce. When you look at opportunity, I think barriers definitely still exist. And they often say there's no story better than a personal story. So I wanted to share one with you that I am actually living. My fiance, Sean, was raised by a single mother and his grandparents. He didn't quite know what to do after high school, so he decided real estate was it. He had an in and he was gonna do fabulous. So he went on with that very ambitious goal. Well, that bubble burst. And what was he to do? He managed to land a position in the radiology department at Kaiser Permanente in Roseville. Friends of friends had encouraged him, the real estate bubble might have burst, but healthcare certainly will not. After learning firsthand what those opportunities look like, he realized he discovered a whole new world, one where his compassion for people and his love of technology could combine and flourish. So he decided sonography it is. When he started down this path to get his ultrasound license, the requirements were set as one way. If I understand, there were some prerequisites in line. So of course, as a diligent student, he worked full-time and worked towards his prerequisites. Well, just about the time of application, they changed. Now, he had to get a degree in order to meet those prerequisites to apply. So, of course, he continues to chug along, working full-time, adding school, to that lifestyle. And finally, he makes it. He's got all of the standards ready to go. He's ready to apply. So we looked at his school. It had great reviews. It had a loan forgiveness program, wonderful job placement rates. But living in Roseville, it was in the Bay Area. So 2 hours away, we struggled with what to do. Should we try to get an apartment for him? Should he live with a family member that was still an hour away from the school? Could we afford living in two places at one time? How would he work? If he left his job at Kaiser that he now has some really wonderful seniority, what does that future look like in making some of those decisions? So many questions. So of course we made a plan, because, I'm a planner. And he applied for one of the 30 seats available at the school. So each year, 30 coveted gold-laden seats, it seems like. And he got denied. So they said, you know what? It's kind of like this. You'll be fine. The first year, nobody gets in. So year 2, wait along, tries again. No dice. Of course, then he's like, okay, is it me or is it you guys? He tries to become a more competitive candidate, works, behind the scenes to volunteer, to get more interested, to get some of those hours, to show his interest, as well as get some letters of recommendation, and really does his homework. Okay, 3rd year is the charm, and no dice. So what did that mean? That meant he had to assess different opportunities. He, despite working hard and feeling like he was really invested in this, last year he decided to look at other schools. There happened to be one much closer to where we live, which eliminated some of that commuting issue, but it's 3 times the price. So weighing the trade-off between a 4th disappointing letter or, just paying it out at the beginning and kind of seeing how it goes, it seemed to be a pretty easy choice at that point. He applied and was accepted to the 2018 and 2019 program. And while he, I think, is a special case because he is fortunate enough to enjoy that seniority that I mentioned, have a very supportive system through the leadership at Kaiser and his union at SEIU UHW to find a new position at Kaiser that would support his lifestyle. So I'm very proud to say he's now 11 months through and loves his decision. But as I mentioned, it's a whole new lifestyle. So to provide a glimpse of that, he goes to school from 8 to 2, Monday through Thursday. Then off to Kaiser, 3 to midnight, Wednesday through Sunday. And then tries to find some sleep, tries to eat and study in the hours in between. And of course, prioritizing our time together as well on those Monday and Tuesday afternoons, right? We've still got 13 months to go, but until he's prepared to take his state exams, which for the record does not fall under my agency, so there will be no undue influence. Now, when I take Sean's story, which is a very personal story, and add the barriers that I know exist here in rural communities, oopsie, that's upside down. And again, the slide's kind of goofy here. I like to think that, his struggles and barriers only represent half of the ones that I could think of on my own. Pre-licensing requisites changing on them, right? Sort of students aren't always aware of what our good legislators and regulators are doing. The number of seats and capacity. Cost, of course, working full-time, but add to that the particular layers here in the Central Valley. The distance to his education is fortunately only 30 minutes away. Here in the Central Valley, I hear you all have to drive quite a bit. And access to broadband. He is fortunate enough to come home and be able to log on to his laptop at any point of the day or night to make sure that his assignment gets in or that he gets to do that extra bit of studying for his practical exam the next day. So, when you look at all of these challenges, my goal is to really help paint a pretty clear picture for you. Sean is one determined guy, I gotta tell you. And he has definitely seen a struggle. But, I like to think he's poised to succeed from the outset. When you add on all of these other layers, what opportunities are there, to highlight, I think, the challenges that our students here in the Central Valley need to address. So I hope you keep in mind that the work that you do here today and that you take back with you to your government entity, your private company, your nonprofit, or your academic institution can really make a healthier tomorrow for many Californians. Aspiring licensees and students will continue to play a critical role in shaping the future of healthcare professions, but it will take all of us, as the chancellor said, to ensure that those pathways exist, that they're accessible and connected in such a way that allows success. While we have a transition of administration ahead, I feel very confidently promising you all that our department will continue the mission of ensuring consumer protection by, of course, focusing on a highly trained licensed workforce. We will continue to serve as a resource for aspiring licensees and ensuring that students are aware of those licensing requirements, education, financial costs, so that they can plan their careers accordingly. And we will continue to be a partner in identifying and addressing workforce disparities, be it race, ethnicity, geography, or more, to ensure that California's healthcare workforce diversity reflects its patient population. Thank you so much for being here today. And as Chancellor Van Horn mentioned, this is a challenge for the next year, but also for the next 4. We have a very captivating audience in the next administration coming in who has said that one of the priorities is healthcare. So I encourage you to continue to carry your torch, whether that be it from the Central Valley perspective, from your specific institution perspective, and really be a part of the conversation, whether that's locally or at the state level. We need experts and we need boots on the ground that can tell us really, hey, you guys, that direction's wrong. Or if you tweak it a little bit and go an inch left, it'll be just right. So I look forward to tackling the day and, of course, our healthcare workforce alongside you. Thank you so much.